Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a consultant orthopedic surgeon talking to a patient called Mr. Ben. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Ben. I see your GP has referred you to me regarding some knee issues you've been having. Could you tell me, in your own words, what kind of problems you've been experiencing?
Yeah, sure. Well, it's my right knee mainly. I've been having this pain for a few months now. At first, it was just a little discomfort, but over time it's gotten worse. Sometimes it's so bad, I can't even walk properly.
I see. When did you first start noticing the pain?
Probably around 5 or 6 months ago. It wasn't too bad at first, like I said, but it's just gradually become more intense. Some days, it feels like my knee is going to give out on me completely.
Can you describe the pain? Is it sharp, dull, throbbing?
It's more of a constant dull ache most of the time. But when I move certain ways, like going up or down stairs, it gets sharp. Sometimes, if I twist the wrong way, it feels like something is grinding in there. It's really uncomfortable.
That sounds painful. Have you noticed any swelling in the knee?
Oh yeah, definitely. By the end of the day, it's swollen, especially if I've been on my feet a lot. I try to ice it, which helps a little, but the swelling doesn't really go away.
And has your knee ever locked or felt like it was catching when you move?
Yeah, actually, a few times. It's strange. I'll be walking or standing up, and it'll just kind of lock in place for a second before I can move it again. It's a bit scary when it happens, because I never know when it'll come on.
That must be worrying. Have you had any injuries to that knee in the past, like a sprain or any kind of trauma?
Not really. I mean, I played football when I was younger and had a couple of knocks, but nothing major that I can remember. I did twist my knee about a year ago while gardening, but it wasn't that bad at the time. Could that be part of it?
It's possible. Sometimes even a minor injury can cause issues later on, especially if it wasn't treated or rested properly. Do you notice the pain getting worse during any specific activities?
Definitely when I'm walking upstairs or squatting down to pick something up. Even just standing for a long time makes it worse. I've had to cut back on exercise because it's too painful. I used to run a bit, but I can't even think about running now.
It sounds like this has really affected your day-to-day activities. Have you tried any treatments so far?
Yeah, I've been taking ibuprofen to help with the pain and swelling, but it doesn't do much anymore. I tried wearing a knee brace for support, which helps a little when I'm walking, but it's not a permanent fix. I also tried resting it for a week or 2, but the pain came right back as soon as I was active again.
Alright, and how has this been affecting your sleep? Any trouble at night?
Oh yeah, big time. If I move the wrong way in bed, the pain wakes me up. Some nights, it's just throbbing all the time, and it's hard to find a comfortable position. I'm definitely not sleeping as well as I used to.
I can imagine that's frustrating. And how's your overall mobility? Has this affected your ability to get around?
Yeah, for sure. I've had to slow down a lot. I walk with a bit of a limp now, especially when the pain is bad. I can't go for long walks or do any of the activities I used to enjoy. It's like my whole life has changed just because of this knee.
That must be difficult to deal with. Let me ask you about your overall health. Any other issues like back pain, weight changes, or other joint pain?
My back's fine for the most part, though I do get some lower back pain when I'm on my feet too long. As for weight, I've actually gained a bit because I've been so inactive. I'm not able to do as much exercise, so I guess that's part of it. My other joints seem fine though.
It's common to gain a bit of weight when activity levels drop, and that can sometimes put more pressure on the knee. I'm going to do a physical examination to check your knee's range of motion, stability, and see if there are any signs of ligament or cartilage damage. We'll likely need to get some imaging, like an X-ray or MRI, to get a clearer picture of what's going on inside the joint.
Okay, that makes sense. Do you think I'll need surgery?
Extract 2, questions 13 to 24. You hear an oncologist talking to a patient called Mrs. Wright. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Wright. I'm glad you could come in today. How are you feeling?
Morning, doctor. I've been better, honestly. I'm trying not to worry too much, but it's hard. My dentist found a sore in my mouth that hasn't healed, and he's worried it might be something serious. That's why he referred me to you.
I understand how concerning that must be for you. It's good that your dentist took it seriously and referred you for further evaluation. Can you tell me more about the sore? When did you first notice it, and have you had any other symptoms?
I first noticed it a couple of months ago. It's a small ulcer on the inside of my cheek, and at first I thought it was just a canker sore or maybe something I bit by accident. But it didn't go away. It's still there, and it's painful, especially when I eat. I've also noticed some swelling around my jaw and a bit of numbness in my lip. My dentist said these could be signs of something more serious, like mouth cancer. I'm really scared, doctor.
I completely understand your concern, Mrs. Wright. Mouth cancer, or oral cancer, can present with symptoms like the ones you've described, a persistent sore, swelling, or numbness. However, it's important not to jump to conclusions until we have more information. There are other conditions that could cause these symptoms, too. The next step is to conduct a thorough examination and possibly a biopsy to determine exactly what we're dealing with.
A biopsy? Does that mean you think it's definitely cancer?
Not necessarily. A biopsy is just a way to be certain about what's causing the sore. It involves taking a small sample of tissue from the affected area, which we then analyze under a microscope. This will help us determine if there are any cancerous cells present. It's a crucial step in making sure we diagnose the condition correctly, whether it's cancer or something else.
I see. It's just hard not to think the worst. I've never smoked, but I know that doesn't mean I'm completely safe from cancer. What are the risk factors for mouth cancer?
You're right that smoking is a significant risk factor, but it's not the only one. Other risk factors include heavy alcohol consumption, exposure to the human papillomavirus, HPV, a history of prolonged sun exposure, which can affect the lips, and even chronic irritation from things like ill-fitting dentures. Genetics can also play a role. However, it's also possible for someone with no obvious risk factors to develop mouth cancer. That's why regular checkups and being attentive to any changes in your mouth are so important.
I've always tried to take good care of my health, so this is really frightening. What happens if it does turn out to be cancer? What are my options?
If the biopsy confirms that it's cancer, we'll need to determine the stage of the disease. The stage tells us how much the cancer has spread, which helps guide our treatment options. Early-stage mouth cancer is often treated with surgery to remove the tumor, and this can be very effective. In more advanced cases, we might also use radiation therapy, chemotherapy, or a combination of treatments. Each treatment plan is personalized, so we'd discuss all the options in detail to find the best approach for you.
I appreciate that. I just want to get through this and be healthy again. How successful are these treatments? What's the outlook?
The success of treatment depends on several factors, including the type and stage of the cancer, as well as your overall health. The earlier we catch it, the better the outcomes generally are. For early-stage mouth cancer, the prognosis is often quite good, with many patients achieving full recovery after treatment. Even in more advanced stages, there are effective treatments available. The key is to take it one step at a time. We'll focus on getting an accurate diagnosis first, and then we'll move forward from there.
That makes sense. I've been so anxious about what might happen, but hearing that there are options gives me some hope. What can I do in the meantime? Should I change my diet or lifestyle?
It's always beneficial to maintain a healthy lifestyle, especially when facing a potential health issue. Eating a balanced diet rich in fruits, vegetables, and lean proteins can support your overall well-being. If you drink alcohol, it might be a good idea to reduce your intake, as alcohol can contribute to mouth irritation. Staying hydrated and avoiding any additional trauma to the sore, like eating very hot, spicy, or rough-textured foods, can help minimize discomfort. If you're not already doing so, it's also a good idea to avoid tobacco in all forms. These steps can help you feel better and support your body as we move forward with the diagnosis and treatment plan.
I can definitely do that. I've already cut back on alcohol, and I'll be more careful with what I eat. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a discussion between a pulmonologist and an intern. Now read the question. So, Alex, what do you know about your patient?
The patient is a 45-year-old woman presenting with a chronic cough that has lasted for over 8 weeks. She has no significant smoking history but mentioned exposure to second-hand smoke in the past. She has been experiencing a dry cough and there is no associated wheezing or shortness of breath. She's otherwise healthy, with no history of respiratory conditions.
What do you recommend as the next step?
During my examination, I didn't find any obvious signs of infection, but I recommend performing a chest X-ray to rule out any underlying issues and possibly follow it up with pulmonary function tests if needed.
What are the common causes of a chronic cough?
Chronic cough can be caused by conditions like asthma, postnasal drip, or gastroesophageal reflux disease, among others.
Now look at question 26. You hear 2 colleagues talking to a patient. Now read the question.
She's been managing basic tasks like brushing her teeth and getting to her chair, but that doesn't mean she's ready for outdoor activities.
She's been in this room for days, and it's affecting her mood. A little sunshine could do wonders for her recovery.
I understand that, but we can't ignore her recent surgery. I know she feels ready, but I really think it's still too much for her.
I'll go with her to make sure she doesn't overdo it.
I'd rather she wait until the doctor clears her. We don't want her pushing herself too soon and risking a setback.
Now look at question 27. You hear a Dr. Williams talking to a presenter. Now read the question.
Now let's discuss the case of Emily, who was referred to us by her primary care physician. Sarah, could you present the case, please?
Certainly, Dr. Williams. Emily is a 3-year-old girl who has been showing signs of developmental delays. According to her records, she has not yet started speaking in complete sentences, and her vocabulary is limited to a few words. Her parents have also reported concerns about her motor skills, noting that she has difficulty with tasks such as holding objects and maintaining balance when walking. A basic developmental assessment was done, but it was inconclusive.
This is concerning. It sounds like there are a number of areas where she might be delayed, but we don't have enough information yet. Sarah, please gather a comprehensive developmental history and include any relevant family history. Depending on what we uncover, we can decide whether a referral to a pediatric specialist is necessary.
Now look at question 28. You hear a nurse discussing a patient's condition with a doctor in a burns unit. Now read the question.
Mr. Delgado has sustained severe burns after coming into contact with an industrial hot liquid at his workplace. Upon initial assessment, the burns cover approximately 20% of his body surface area, primarily affecting his torso and upper arms. The burns are suspected to be a mixture of second and third degree. Due to the location of the burns and the significant surface area affected, we've initiated intravenous fluids to manage his hydration and prevent shock. I recommend reassessing the depth and size of the burns over the next few hours as the extent may worsen, and we'll need to classify the injuries to guide the ongoing treatment plan.
Now look at question 29. You hear 2 nurses talking to each other. Now read the question.
I can't find the psychological assessment results for Mr. Mike. Did you follow up on that last one?
No, not me. Let's see. Yeah, here it is. The last assessment was yesterday, and it shows that he's still very fixated on having his left leg amputated, even though there's nothing physically wrong with it. We should arrange another session today to reassess his mental state, as it might have shifted. He's really struggling with the idea of keeping the leg. It was difficult convincing him to talk last time. He's definitely a challenging patient. If you feel comfortable, you could try speaking to him next.
Okay. I suppose it's my turn.
Now look at question 30. You hear a discussion between an intern and a doctor. Now read the question.
The case study from today's session on managing hyperlipidemia. Do you have a moment?
Of course. What would you like to clarify? Was anything unclear about the recommended treatment plan to lower the patient's cholesterol levels?
Not the treatment plan itself. I understand the recommendation for patients with elevated cholesterol levels to adopt lifestyle changes, like a healthier diet and increased physical activity. But why are statins considered the first line of treatment, even if lifestyle modifications are also emphasized?
That's a great question. While lifestyle changes are important, statins are recommended as the first-line treatment because they significantly reduce the liver's production of cholesterol, which helps to lower LDL, bad cholesterol, or levels more effectively. In addition, Statins can reduce inflammation in blood vessels, which decreases the risk of cardiovascular events.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a discussion with Dr. Alex Myers about robotic-assisted surgery. You now have 90 seconds to read questions.
Hello everyone and welcome to today's discussion on an exciting topic in healthcare technology, robotic-assisted surgery. I'm joined by Dr. Alex Myers, a pioneer in the field of robotic surgery. Let's give him a warm welcome as he shares insights into the use of robots in surgical procedures.
Thank you so much for having me. I'm really glad to be here today to talk about this revolutionary advancement in surgical care.
Dr. Myers, robotic-assisted surgery seems to be growing in popularity, but for those who may not be familiar with it, could you briefly explain what it is and how it differs from traditional surgery?
Of course. Robotic-assisted surgery is a type of minimally invasive surgery where the surgeon uses a robotic system to perform the procedure. The key difference between this and traditional surgery is that, in traditional surgery, the surgeon operates directly on the patient using handheld tools, whereas in robotic-assisted surgery, the surgeon controls robotic arms from a console. The robot provides greater precision, dexterity and access to hard-to-reach areas of the body, which is a significant advantage.
That sounds impressive. What would you say are some of the primary benefits of robotic-assisted surgery for both the surgeon and the patient?
There are several benefits for both parties. For the surgeon, robotic systems offer enhanced control and visualization with 3D high-definition images of the surgical site. This allows for greater accuracy, especially in complex procedures. For the patient, robotic surgery usually means smaller incisions, reduced pain, less blood loss, and a quicker recovery time compared to traditional surgery. The precision of the robotic arms can also minimize the risk of complications, which is crucial in delicate operations like prostate or heart surgery.
Those are some significant advantages. However, we know that no system is without its challenges. What are some of the drawbacks or limitations of robotic-assisted surgery?
You're absolutely right. While robotic surgery offers many benefits, there are also challenges that need to be addressed. One major limitation is the cost. Robotic surgical systems are expensive to purchase and maintain, which can make them inaccessible for smaller hospitals or those in low-income areas. There's also a steep learning curve for surgeons. Operating the robotic system requires specialized training,
and it takes time for even experienced surgeons to master the technology. Finally, the robotic systems can sometimes be cumbersome, and any technical malfunctions could delay a procedure.
Those are important points. I imagine cost and accessibility must be major factors when hospitals are deciding whether to invest in this technology. Have there been any advancements or strategies to address these challenges?
Yes, absolutely. In terms of cost, there has been a push towards making robotic systems more affordable and accessible. For example, some manufacturers are working on developing smaller, more cost-effective robotic platforms. Another strategy that has been explored is sharing robotic systems between hospitals, particularly in regions with limited resources. This allows multiple facilities to benefit from the technology without the full financial burden falling on a single hospital. Training programs are also becoming more sophisticated, with virtual reality simulations helping surgeons practice in a controlled environment before performing actual surgeries.
That's great to hear. You mentioned earlier that robotic surgery can be especially beneficial in complex surgeries. Could you give us some examples of procedures where robotic assistance has made a particularly big impact?
Certainly. One of the areas where robotic-assisted surgery has had the most impact is in urology, particularly prostatectomies for prostate cancer patients. The precision offered by the robot allows surgeons to remove cancerous tissue while preserving surrounding nerves, which can improve the patient's quality of life post-surgery. Another area is cardiac surgery. In procedures like mitral valve repair, where access is limited, the robot's ability to operate in confined spaces is invaluable. It's also been used successfully in gynecological surgeries, such as hysterectomies, and in general surgery for procedures like gallbladder removal.
That's fascinating. It's clear that robotic surgery has already made a significant impact in many areas. So, looking ahead, what does the future hold for robotic-assisted surgery?
The future is very exciting. We're seeing the development of even more advanced robotic systems with greater automation and artificial intelligence (AI) integration. These systems may one day be able to assist with decision-making during surgeries, or even perform certain parts of the procedure autonomously. AI could help surgeons identify critical structures in the body more quickly, or analyze patient data to suggest the best surgical approach. Another area we expect to see growth in is telesurgery, where a surgeon in one location can operate on a patient in another, thanks to robotics and remote technology. This could transform surgical care in underserved areas.
It sounds like the future of surgery is headed in a remarkable direction. What challenges do you anticipate as we continue to integrate AI and remote capabilities into surgery?
The main challenges will revolve around ensuring safety and reliability. For instance, AI will need to be rigorously tested before it can be trusted in high-stakes surgical environments. Additionally, with remote surgeries, there are concerns about network reliability and security. A stable connection is vital when performing surgery remotely. And cybersecurity risks must be addressed to protect patient data and prevent unauthorized access to the surgical systems. Despite these challenges, the potential benefits are enormous, and I'm optimistic that we'll see these technologies being safely integrated in the coming years.
Thank you, Dr. Myers, for sharing such valuable insights. It's clear that robotic-assisted surgery holds immense promise, and I look forward to seeing how these technologies evolve.
Thank you for having me. It's been a pleasure to discuss this important topic.
Extract 2. Questions 37 to 42. You hear a presentation about the effectiveness of new vaccines in preventing childhood diseases. You now have 90 seconds to read questions. Good afternoon, everyone. Today, I'm excited to share the findings of a recent study conducted by the Health and Immunization Research Center. Our focus has been on the impact of newer vaccines in preventing common childhood diseases, specifically measles, whooping cough, and chickenpox. Over the past decade, there has been a significant increase in vaccination coverage for these diseases in most developed countries, thanks to improvements in vaccine availability and healthcare awareness. However, challenges remain, especially regarding public trust and vaccine hesitancy. Let me start by giving a brief overview of how these vaccines have helped to change the landscape of childhood health. Measles, which was once a major cause of death among children, has been dramatically reduced. In countries with high vaccination rates, measles has become extremely rare, with outbreaks mainly occurring in regions where vaccination uptake is low. The measles vaccine has shown to be over 97% effective after the second dose. Similarly, the whooping cough vaccine, which is often part of a combination vaccine given during infancy, has helped prevent countless cases. Although booster doses are sometimes necessary as immunity can decrease over time. Chickenpox used to be a common illness that nearly every child experienced before the age of 10. With the introduction of the chickenpox vaccine, rates of infection have dropped significantly. A recent analysis revealed that the vaccine is approximately 90% effective at preventing the disease, with vaccinated children often experiencing much milder symptoms, even if they do contract the virus. By minimizing the incidence and severity of these diseases, vaccinations also reduce complications, hospitalizations, and even death among children. One of the studies we conducted focused specifically on how effectively the vaccine programs have reached their target populations. It turns out that while coverage is generally high, there are pockets of communities where vaccination rates fall below the ideal threshold, making them susceptible to outbreaks. These communities are often influenced by a combination of misinformation, limited healthcare access, or cultural beliefs that lead to hesitancy. This has resulted in localized outbreaks of whooping cough and measles, even in regions where these diseases were almost eliminated. To combat these challenges, health professionals are looking at several approaches. One such approach involves better education campaigns that address misinformation and build trust in vaccines. Healthcare professionals are also encouraged to have personal conversations with parents to address their concerns. Another effective strategy is school-based vaccination programs, which help reach children who might otherwise miss regular healthcare visits. The end goal of these efforts is to reach herd immunity, where a high enough percentage of the population is vaccinated to prevent the spread of these diseases, thereby protecting those who cannot be vaccinated for medical reasons. We also explored the effectiveness of introducing new booster schedules. For whooping cough in particular, it appears that while initial vaccination rates are strong, there is a drop-off in older children and teenagers receiving boosters. These booster doses are critical because immunity can wane over time, leaving older children and adults susceptible to spreading the disease to infants who are not yet fully vaccinated. To address this, some countries have started providing boosters at specific milestones, such as during adolescence or pregnancy, to ensure that vulnerable infants are protected from exposure. In conclusion, these vaccines have been remarkably successful in reducing the incidence and severity of common childhood diseases, but challenges remain, especially in increasing public trust and ensuring coverage across all demographics. Moving forward, efforts to enhance education, provide convenient access to vaccines, and support ongoing booster schedules will be key in maintaining and expanding the gains made in childhood health. That is the end of Part C. You now have 2 minutes to check your answers.